do is get my equipment. I'm going to check my saline, 24 hours, date, time, and label. And if this was open this morning, before I use it, I'm going to pour some off the top, cover the label, pour some off the top. And what I need is 2 gauze pads. I need a dressing for the trach, my suction catheter with my sterile gloves and everything in it, and my inner cannula. And I know I have the right size inner cannula because it's going to tell me on the phalange, which is this little thing here. It has a number on there, and it also will tell me on the packet. So I got my little garbage. This is going to be my garbage over here. And what I'm going to do is put on my, okay, I don't have a stethoscope. Would you give me that stethoscope off my desk, please? So I'm going to put on my clean gloves, and what I want to do is put on my clean gloves, and I want to first come in, I want to listen to the patient's lungs. So I'm going to listen to the patient's lungs posterior. So I'm going to raise the patient head or turn the patient to the side. So what I'm going to do right now is just sit the patient up. And I want to listen from left to right, starting basically at the intercostal space 2. I'm going to go from one side to the other, opposite side, down, across, 7, 8, and 9, you know, are on the side. So you're listening on the side, posterior, you can hear better. You're not listening over a bone, you're just going to go in the vesicular area, listening for the breath sounds. Then the next thing that I'm going to do is check my suction pressure. So I'm going to turn the machine on. I'm going to kink the tube, and what will happen when I turn this on, this dial is going to go up to the number that I want, usually 100 to 110. And you can get a towel or whatever, and you can place in front of the patient, and you can just lay that there. And this is my suction. I'm going to get this NG tube out of the way, so it won't be in the way, and pull this down. Now, the next thing that I want to do is pre-oxygenate the patient. So I want to give the patient 100% oxygen for a minute or so. And usually on the vent, there is a dial with oxygen anywhere from 0 to 100%. Just put it to 100 for a minute or so, and then make sure you turn it back down. You got to be careful to turn that back down to the pre-set rate. Otherwise, you know, you don't want to touch that. Otherwise, you can use an ambu bag to give 100% oxygen. Pull off my gloves. Make sure you pull your gloves off from the center, go under. Then I'm going to put this in the garbage, come over here, and I'm going to get my suction catheter. I'm going to open this up. You want to make sure you touch the outside only. Don't touch the inside because that's sterile. I've already checked my saline. I'm going to cover my label, pour my saline in. I'll put that over to the side. Then I'm going to open my pack. This is sterile, only touch the 1-inch margin. This little wrapper here should not touch anything going to the 1-inch margin. This should be on top, so I'm just going to put this on top. So I'm right hand, I'm going to put my right hand on first. I'm going to take this by the cuff. I'm just going to put this on. Thumb up, 4 fingers. I'm going to go under, pick this up. I'm going to put this glove on. I'm just going to do this so I'm sterile. So I'm going to take this. I'm going to hold the catheter like so. Now this becomes my dirty hand or clean hand. This is my sterile hand. And I'm going to test my catheter by using intermittent suction. When I do this, it's intermittent. If I hold it constantly, it's continuously. So I'm going to check the catheter. When I do this, fluid from this cup is going to come up through the tube and go into the canister. So I see that it's patent. I'm going to keep the catheter like so. Take this, do it quickly and gently. I'm going to go down until I meet resistance. Hopefully this catheter. Come up a little bit, rotate, intermittent suction. Give the patient a break. I'm going to apply oxygen, monitor the patient for respiratory distress, clean my catheter, and the patient still need to be suctioned. So I'm going to go down again quickly and as gently as I can. Meet resistant, come up, rotate, intermittent suction. So the patient sounds clean. Sounds like the lungs are clear. So I'm going to put my oxygen back on, disconnect my tube in. I'm going to turn off my suction. I'm going to grab the dressing, pull off my gloves, and now all of this is garbage. So now what I need to do is do my site care. I'm going to do my site care.
Is that painful to the patient?
What's that?
Is that painful to the patient?
It can be a little uncomfortable, but when the patient gets used to it, it's not painful. When they just do the trach, can be painful. So what I need now is my gauze pads. I'm just going to open them up. This is clean, a clean procedure now, not sterile. I got my inner cannula, and now my peroxide. The date of the peroxide is according to company policy, maybe 30 days. Okay, so I'm going to put on my clean. I didn't get Q-tips.